Which of the following medications would be the most appropriate treatment for this patient's condition? Spironolactone, hydrochlorothiazide, furosemide enalapril, or amlodipine. A 6-year-old girl is brought to the pediatrician because of poor growth, frequent headaches, and lethargy. Physical examination reveals hypertension and no edema. Laboratory tests show hypokalemia, low plasma renin activity, and normal aldosterone levels. Detailed family history reveals the girl's father had similar symptoms during his childhood. What of the following medications would most be appropriate treatment? Oh, I struggle with these. I see all these lab values and I get struggle, but I feel like for some reason my mind went to like one of those like I don't know Barter syndromes or like things like that when I see hypokalemia, hypertension. Um, I don't know. Hypokalemia, you would think, I mean, if I'm just looking at hypokalemia, you'd want like a potassium sparing diuretic to help get that back up.
Okay.
But why am I don't know. I don't know. Okay, so low plasma renin, normal aldosterone. So that means you have I guess normal adrenal glands, low plasma renin would be like I guess non-functioning kidneys. I don't know actually. I'm kind of already stuck. Um, my gut would probably be just to pick spironolactone,
Okay.
but um I don't know why I also think just amlodipine, but I don't know. I'll go with that because I really don't know where to go from here.
Okay. So yeah, spirulina and lactone. I always keep these as simple as possible. Okay. In my mind, I'm like, okay, so hypokalemia, right? They give you a bunch of diuretics. Okay. In my mind, right? And so exactly kind of first thought, even though sometimes when you're doing a test taking strategy, right, and you're like, oh, maybe I don't know the diagnosis here, you have to ask yourself, okay, what can make this worse, right? And remember, hypokalemia or low potassium or too high potassium, what does that affect?
The
If
heart,
yeah, your heart, right, which is the
yeah.
worst thing you can have, right? So potassium is one of the things. I mean, even as a clinician, when you're taking care of a patient, that's going to be one of your main things that you're like, oh, okay, I gotta make sure that your potassium is normalized because they can get arrhythmias and then all of a sudden have have some kind of issue where the electronics of the heart doesn't work and they could die. So sodium and bicarb and the rest of the electrolytes, they're a little bit more forgiving, right? If you're outside the range, but potassium is the most, you got to be careful about that. So in my mind, when I'm thinking about this, okay, so I can't give anything to make the hypokalemia worse, and so you're going to pick the only one that spares, potassium, right? So that's going to be your best answer here. So um similar instance, just a
Little syndrome.
little syndrome, right? Which I can't remember this in particular, right? But distal nephron, right? And so it's practically you're having issues with that reabsorption, things like that. So just something to think about. But yeah, so spirulina lactone is going to be your best answer choice here, mainly for your hypokalemia. So good job.